order. Ms. Hodge, would you do roll call for us?
Mr. Breitling?
Here.
Mr. Steen?
Here.
Ms. Fry?
Here.
Mr. Hagan?
Here.
Ms. Haugen?
Here.
Ms. Comer?
Here.
Mr. Madler?
Here.
Ms. Bollinger?
Here. In your packet that was emailed out to you from Heather, there was the minutes from our July 5th board meeting. Does anybody have any additions, corrections? If not, I need a motion to approve.
Move to approve.
Second?
Second.
All in favor, say aye.
Aye.
All opposed, same sign. Thank you. Next item on the agenda, which we included in the packet that was emailed out, is just a reminder. I think one of the first zone board meetings in January, Kristen Hasbargen, Director of Zone Operations for DHS, kind of did an overview and kind of showed this. But I thought it was, now that we're about 6-7 months into it, another good reminder of, because it's really still new to all of us, so I'm good with a handout more than looking at it online. So the Human Service Zone Board and the roles, and the commission roles, kind of a really good infographic, just as a reminder and maybe to jog my memory again, and I thought I wanted to share it with all of you as well. So any questions? It was just really included in the packet as information. Go ahead.
Just a comment, I think this does a really good job, especially explaining to the zone board members what we're supposed to be doing and that type of thing. So I think it's an excellent tool for everybody, but I'm looking at our use. Mm-hmm. And on the county commission side, I think it works out really well as well. And just two things on the county commission. We did receive and ratify both the direct fund budget and the indirect cost budget preliminary approval last week.
Yep.
And tonight I'm assuming we will probably approve it in final form.
Thank you. I noticed that too, so I thought, I should make sure on that regards too. Thank you, Commissioner Steen. Any other questions or comments?
The only comment.
This is Julie. Can you hear me?
Yeah, Julie, go ahead.
I too thought it was a great visual and super helpful. Under the Human Service Zone Board, the very first responsibility, establish policy to review and approve claims against the HSZ fund. As a new board member, I thought to myself, have I done that? Are we doing that? I needed more clarity around that one.
I find that interesting you bring that up, Julie, because as I was reviewing for today's meeting too, I was like, I believe that is related if there is any significant outside claim in an appeal or things like that. But I need to check some more into that. Anybody else? Dwayne, I know you had a question.
It wasn't a question as much as a comment as to Commissioner Steen's response to the budget process. I think it's important to know and understand that the legal staff that provide services to zone are not included in that budget. They're included in the state's attorney's budget. So it's a little more costly to the county than what would appear from indirect cost annotation.
Correct. Julie, I know that didn't answer your question, but I was going to get some more clarity as I was reviewing that this morning, but that's how I understand that.
I also have
Thank
a
you.
question on the same one. So anyway,
Okay.
Go ahead, sorry.
Go ahead, Rick.
Gail, if you're wrong on that, then there's two of us.
Okay.
Wrong on that presumption, so it could be wrong.
Okay.
That's
I'm
the way I
assuming
heard it
if
as
there's
well.
any type of claim, employee or constituent or customer, that would, the board would be involved in that process. Mr. Hagan?
I had the same question.
Okay.
On the same ones.
Anything else related? I'm glad you found it as a good overall reminder, because I thought I have to look at that, so I thought I would share. I want to welcome Mr. Matt Gephardt is with us. Matt started last week, July 25th, Monday, July 25th. We've entered into an agreement with Matt to provide technical assistance and kind of consultant services for our family services department. He is coming on board. He has started meeting with him in the beginning part of July. He's a longtime professional in child welfare with probably 25-year plus. I will let him give you a little more of his background. He has been in Wisconsin, Washington State, Colorado, the Casey Family Foundation, providing support, as well as has assisted in the practice model, rolling that out in Redesign in the state of North Dakota. So he's hit the ground running. As of Monday, I checked in this morning. I said, how was last week? And he shared he was tired this weekend, but it's all good. We've learned, we're growing, and it's going to be, I think, a wonderful way to onboard a new family services manager, bringing somebody with Matt's background and expertise for our staff and to look at our processes and move forward. Matt, I'm going to turn it over to you.
Sure. I'm here to answer questions, and you did a great job introducing me. I'm a longtime child welfare professional, former county director in Napa County, California, operations director in Yolo County, California.
You might want to take the
Oh,
mic
sorry.
a little, because they
Okay.
might be better to hear.
Excuse me. Work with the National Resource Center for Child Protective Services, and have worked with counties, states, and tribes, both for them as well as Casey Family Programs as a nonprofit entity that's worked all over the country. So I'm really happy to be here, and an opportunity to meet with your team and really talk about developing their leadership, really looking at developing their practices, and a really way of supporting and retaining high-quality staff, all in the service of strengthening the community, strengthening families, and really look at a way of building a child protection system that's not about the child welfare agency. How do we create a system that ensures kids are safe? And child safety is always paramount.
Anybody have any questions? Go ahead.
Just clarification, because the introduction on the agenda talks about child welfare consultant and technical support for family services. You're coming on board as a full-time employee, correct? Or not?
We're in this, has a service agreement for X amount, up to X amount of hours.
Okay.
So,
Half a year, quarter of a year? I mean, what are we talking? I'm just curious.
it depends on how well things go. It's X amount of hours, so I think if that would be 6 months. But depending on our new family services manager, will be onboarding mid-September. And I think in making that onboarding process it might slack off in the hours, once a little bit of time has passed. I would think it's kind of as we go and see. We're talking about, and Matt can probably explain this a little bit better, even at the end of last week, looking at what specifically we need done in training to really strengthen and provide front-end assistance to strengthen workers and the process for assessments and things like that we can do internally here to get that strengthened and move through some of, lack of a better word, backlog. Is that how to do?
Yeah, I mean, there's a lot of foundational stuff, to be really frank with you, that we got to get better at. And it has to do with how we gather information, how we engage families, and then how we assess and make decisions. And there's just fundamental structures around how that has to happen and how supervision must occur. And so there's a lot of building blocks, and there's a lot of old practices and old ways of doing business, and sometimes will be barriers and sometimes won't. And so I think, as you mentioned, we're sort of building this as we're flying it, but I think we're going to get a clearer picture every day of what, especially the upfront part of the system, who do we serve and when do we decide to serve them, really has to be sort of part one in this.
You'll be taking some of the bullet points, and I included that in my director's report, is kind of looking at the practice model and including some of that coaching, case staffing, consultation on practice. So that's really in the front end here now. and to assist our supervisory team in coaching and enhancing those skills in that department as, and then review and evaluate our systems, to make sure, and I think that will be helpful in onboarding a new manager too, to make that lift and evaluate to make sure, like, let's make this more refined and efficient to get the process moving. Commissioner Steen?
Yeah, just to follow up, so with that, talking about processes and systems, how closely is our system and processes tied to the state's?
Our safety framework practice model, I always want to put practice before framework, is the state model across the state. But I think in some of the onboarding of that, due to COVID and training, there needs to be some consistency. That's kind of what we evaluated last week.
I heard like we building blocks and foundation, it's like, isn't that all kind of developed by the state? I mean, isn't the state model and a process that we should be following? And
correct.
so
So we need to refine and train for that. We have a lot of younger workers or newer, less experienced, and really looking at that implementation. And you might have something
Yeah,
to
you know,
say.
so just some context. I started working with the state of North Dakota as a Casey Family Program Senior Director, and it's through that work that the safety framework model was implemented. So I was part of the original design team statewide. And what you find is when you roll out some, especially in child welfare, for whatever the professional culture is, when you roll out something like that, you see some places being really early implementers and other places struggling to do it that way. And there's reasons behind that. And so while it has the criteria and the decision-making is driven by state policy, what we find is some pretty, I'd just say, spotty implementation fidelity. And that's exactly some of what we're going to be working on.
so we're really not trying to rebuild the bus, we're just
No.
trying to get people on the bus.
Correct.
All right.
That's a great way to say it.
Thank you.
I like to simple things down. I totally get that. And any other questions, comments?
Is the contract or the agreement with our zone, or is it with the state?
It's with our zone. Yep, so Matt is exclusively working for the Cass Human Service Zone, in particular family services. So we're fortunate to have him. I think he's been welcomed very well within the zone. And we've had a lot of meetings last week.
Great, yeah, we've been looking at everything from policy and large system stuff to, Friday night, we were staffing one kiddo and what we were going to do before anyone left the office on Friday, so in the range.
Any other comments, questions? Thank you, Matt, for joining. You can stay if you would like, or you can take off. We're usually done by 2, for sure. Next on the agenda is I'll call on Heather to provide a personnel update.
Thank you. Quick update, I provided some turnover data that's in your packet. I included second quarter data, so April, May, and June information. Fairly similar, up just a tiny bit. We did have 5 new hires in July. We did have 1 additional internal promotion. And we did have 8 resignations in July. So we've seen a little bit of shift again. Nothing that we're not continually digging into and certainly addressing. We do have 5 scheduled as of right now, today, to start in August. And so looking forward to that. And we still have about 16 positions throughout the departments where we're in various stages interviewing. We've been doing a lot of interviewing to try to work through some of those. So the turnover data is on the last page, just so that you're aware of the packet. It's page 10. It has settled a bit, but we are on still a slight incline, if you will, as far as looking at a 12-month rolling period.
Heather, you mentioned you had how many starting in August? We had
5 right
5?
now. Yep.
In what department? Are they mixed?
Most of those are in economic assistance, actually. Yeah, we're seeing a transition, like a little bit less in economic assistance as far as vacant positions, and a little bit more now on our family services as far as vacant
No,
positions.
opposite.
No?
Family Services has more? Okay, I thought it was opposite.
It is, it's opposite. So similar, but just a tiny bit.
Any questions for Heather go ahead, Brad,
I
or
got it.
Brian.
I got a quick question. So are we interviewing everybody then as they're leaving? We do it?
Yes,
So any consistency why they're leaving or just?
they are all offered exit interviews. That does not mean they are required to complete an exit interview. We're seeing, the data's coming through, or I guess I'm not seeing any blatant reasons that are consistent, if you will. Is that what you're looking?
Yeah.
Yeah.
Are they going to other businesses or?
Yes.
Getting paid more some other place? Like we've had some issues with that.
Yes, it's a variety of all the things. Some of it have been promotional type steps within their career. Some has been related to finances. It is still very much a variety. We are going to be embarking on a slightly different exit survey process. We'll be conducting that through an electronic means, which has been typically paper up until this point. But we'll be starting that here, if not here in August, soon thereafter. So,
Have you been compiling the responses you've gotten? So
to the best of our ability, because it has been a paper process, it's been hard to see the trends. But we're hoping to change that by having it in electronics so that we can share some of the data more readily on why they're heading out.
And that exit survey that Heather is referencing was put together by a statewide work group from Human Service Zones. So I think it's going to be a really good tool, not only for each zone to look like, and you can readily pull the data off in a way that would be helpful, in a way to share with you all also. So we're looking forward to doing that. And Heather served on that work group and pulling that together.
I'm anxious to have the data digitally so that I can have a little bit more information. The only drawback is it takes a little time to get that trend. So,
Right. Any other questions related to personnel update? The next item on the agenda is an update on the director's review, and I will either turn it over to Mr. Hagan or Ms. Collins to provide an update.
I'm happy to provide a quick update. I've been in touch with all of you individual board members. We're working through that process. You should expect to have another follow-up email from me with a summary of items. Once that's completed, the review process will happen as far as one-on-one. And then we will then call a quick Teams board meeting to capture the completion of the director's review. I would anticipate that to be in the next couple weeks prior to likely our September board meeting scheduled. You'll receive those via email. Can I capture it
Yep.
from your knowledge too?
Yeah.
Okay,
Okay.
all right,
Any questions?
in progress.
Then it's on to the director's report. I handed out, and I sent it to Julie and Robert, so they also have a copy. Just gave a pretty overview. In July, there was a zone directors meeting that was held in Bismarck, and Dr. Weber joined us for a bit, as well as Chris Jones and Sarah Stolt from DHS, and Corey Peterson. There was an update on economic redesign. And the one thing I did include, which I found interesting, the refugee state coordinator joined us briefly and provided an update on North Dakota's Ukrainians. Ukrainians are coming to North Dakota via a program called United for the Ukraine. And there, I included a little handout that they were providing on that. My understanding is these are done through, instead of a resettlement agency, they're done through a sponsorship program. So Holly came to the directors meeting requesting if zones have a Ukrainian refugee coming in for services, to report that to notify her office, because they're not getting a list per se ones coming in. And as of that July timeframe when we met, as of that date, 54 had arrived in Bismarck and 12 to Fargo, or had been reported to her office of refugee resettlement. So the fact sheet on that program is attached, and I just have some general things, but can qualify for the refugee, 2 years of refugee assistance and medical assistance and things like that. Employment assistance, refugee cash assistance, and other specialized programs. Go ahead, Mr.
I
Hagan.
just got a quick question. So we don't know the sponsor then as of today? So it'd be interesting.
It could be, my understanding, it could be me as an individual North Dakota citizen. It could be a group of people. It could be
I know.
Church,
a church,
organization.
kind of.
So we could get 5,000 or 1,000 or 50? I mean, you wouldn't put, 500 in Lisbon. I mean, you'd have to.
Well, they'd have to have the sponsorship for that. If 500 citizens would,
I'm just curious. There must be someone that has some, means of, but so there's 54 in Bismarck. I'd be just curious myself, because usually they would have it coordinated to a degree.
yeah, her request to us, and that's why she was attending, was if we, to encourage our staff to notify her office if we have people seeking services that are identified as Ukrainians from this program. Otherwise, they don't know. That's the gist I took. So
follow up on that question. So what are the requirements of the sponsors? What are they asked to provide?
I didn't ask that question there.
Who do we contact to ask these questions?
Holly at the State Refugee.
Okay.
What
She's
did I-
our contact?
And I can send you the State Refugee Coordinator, yeah.
I actually have her number, maybe you want to be on that or something. I mean, it's just a question, see how they're divvying out people and.
I don't think they're not, it's not like the other refugee programs where there's a resettlement agency and I think the Ukrainians are coming in, what did she call that? Under a, it was a little different process.
Are you involved in that process?
No, I'm not, but, there is not a way to determine,
There's-
exactly how many North Dakota's gonna get. It depends on how many sponsorships.
Well, the U.S. Immigration Service would know where they're going and how many
Yeah.
are coming. I have contacts with the Immigration Service, and they know where they're going and who's coming and all of that stuff. They know where they're coming from. So just curious, like,
I think after the
It's-
fact, we will have numbers that Holly will have
Mhm.
to say that we had this many Ukrainians settle in this program year kind of thing. But, and I suppose a call to the National Immigration Services could say, well, there's a potential for
There's
X amount of families coming
Yeah,
in
there's a,
August or something like that, but.
yeah, my understanding is she didn't have a direct number like we were used to. And at that point in time, the majority were coming into that Bismarck area. The numbers reported. Who knows, we could have more here, but wouldn't be coming in for services. Could be.
these sponsors would have to be on a list too. You just don't.
I think that's through the federal system.
Right.
I don't think, yeah.
Okay.
So that I found interesting. Attached were the June 30th financials in addition, which Shelley Tang, our accounting and budget specialist, was going to be here, but she just had something that came up that she needed to work on. And she did provide the July ones just came through today. So I wasn't even able to print them off. So the ones that are included in the director's report are through June 30th. So that at the end of July, just an update, would be about 58% of our year, and we've expended, as of July 31st, about 51% of our 2022 budget. So we're about 900,000 under budget at that point in time. Most of that is due to wages with long-term employees leaving. So that gives an overview. There's a little more of an update related to economic assistance and our progress to the transition of redesign and eligibility, and I think that's pretty thorough there. We've met with our region. The state's going to be in 4 regions, and we're actively meeting with our region and evaluating needed staff to cover that region. And we will be, in addition, we've been working really closely with RSR, the staff down there, because they're already doing process management in training our staff. And I'll say, what do I call that? We have a pilot team working
Yes.
on, for lack of a better word.
Yes, we have a pilot group that's been working really closely with them. The RSR team is supporting us by conducting some additional training this coming week for our staff. But launching it, our goal to start working within this new step, if you will, it's a new process, is August 15th.
So moving ahead with,
Question about-
yep.
I see here that there's gonna be one call center. And so trying to envision how that call center works. Just at Job Service, we have a call center for one of our programs there. And during the pandemic, that call center used to be solely staffed by Bismarck personnel. And, when the pandemic hit and everyone went to work from home, and so we had some people on that call center all over the state. So how will this call center look? Will it be primarily staffed by employees that are located in Bismarck? Are they located all over the state? And if they are, will there be people in Cass County that take calls from Cass County residents with needs that are very specific to Cass County?
The answer is all over the state, and yes. They will be spread out through the state. The intention is to, that we have interest for some of our staff. They've expressed interest in being part of that call center and being located here. And so we're anticipating that we would have individuals from our area, part of that call center team, supporting those requests.
So just to envision it, so somebody who lives in Cass County, say they are a refugee family like we were just talking about, if they called that call center, they had someone call for them because they don't speak the language, they would actually speak to somebody who is familiar with Cass County and the services that are provided here.
That is the intention, yes.
Yeah. And I think we call it call center for short, but they're calling it a customer care center. So the goal of anybody calling that customer care center, if it's, I just want a new application, I have a question about my SNAP benefits, how do I do this, or I sent this in, that they will not, those people answering the calls will be able to hopefully one and done. Like they'll be more technically inept to the programs in general, that they can maybe answer the questions right there and not have to transfer it to another person. But hopefully, I can't remember how many really is on our plan. We're working with our region to look at the numbers needed. I fully expect we'll have some of those housed here.
Okay, all right, and so there's just, some of those programs are pretty, almost case management, like from that perspective, and clients call with problems, and they're not one and done problems. And so that I'm assuming they have an answer for how they're going to handle that.
Yes.
And with every meeting, I get few more questions answered as we go along. And I think it's the staffing at this regional level. That's our next big step to look at, to make sure we have the right number of positions, and I'm talking in the region, not just in our zone on that. It is a work in progress, so I appreciate that, Carrie. Any other questions? We do appreciate the assistance of our fellow zone in providing some training. I know the team on second floor has found that very helpful. Family services, I just, Matt introduced himself and said a few things about that, so I won't add anything more. But then as of August 1st, effective today, there's a change in state law that connecting children in need of services to their families to appropriate services in the community. And there's a flyer in your packet also that talks about the new, they call it CHINS, Children in Need of Services. And as of August 1st, those referrals are being referred to human service zone professionals across the state. So there was a team of a unit put together of workers for the CHINS unit. And our neighboring zone to the south is the lead in that. But we will have 2 CHINS workers assigned for our region here, for CAST zone. So that's just in the onboarding process as of today. Those referrals will be coming over and working towards, I just had an email from one of them this morning, so working towards that. Any questions?
Gail,
Yep.
I have a question on that.
Yep, go ahead, Julie.
Is this new program, are service providers like YWCA able to make referrals to the program, or should we work through our school contacts to do so?
I would say the school contacts.
Thank you.
Maybe Matt might even have some information on CHINS, but on the referral form, and if I had sent you that electronically, the form, the referral would be on that link. So I should, I did send it to you, maybe it's on that link. But I would work through your schools. I think that's where most of the referrals will come from.
Thank you.
Any other questions, comments, thoughts?
Just for clarification on the CHIN program, so as an example, in my daughter's school, there was a violent situation of violence, fairly significant. So that would go to CHINS, not over to.
My understanding is CHINS is, say, more those tobacco offenses, those runaway offenses, like.
Got it. Yeah, there's a good list here.
Yeah, truancy, there we go, possessions, those type of offensive, the more intensive offensives, that would still be a child in need of protective services, I would assume. So the running away, how it was explained to me is those kind of parenting role kind of things, and then need referrals to community resources or suggestions, having meetings with the family and the parent and saying, there's this resource that you could use. How about, have you tried this out? So knowing those community resources and making the referrals.
How long was that in the works?
Well, it changed in the last legislative sessions.
Okay.
So just as of August 1st is when that law went into effect. So
Sure.
now those referrals will be coming to the zones.
And the 2 that are here, it's you said a brand new unit, like.
They're brand new units, so they're,
Jobs,
new jobs. And actually, the zone lost 2 employees to that unit.
Got it.
So that's a little bit of the shuffle. They're still, they'll be excellent at what they do, and I want to support people, wanting to work with youth in that way. So they will be good.
Okay, thank you.
Yep.
Just have a question on the economic assistance case counts draft that you
Oh, yeah, I
included in your report. And maybe a trend question, seeing the one program, it's steady increase and then it continues to increase all the way through June. Is that cyclical? Basically, we see this every year, or is this maybe related to the economics of the day or both?
I don't know that they've shared any specific reasons why they feel there's that jump. Our staff have also indicated that requests for applications and submissions have increased. I suspect it's economic, but
And if you-
the DHS has not insinuated.
I noticed
Made
that too, and then I went back and looked at the data, and it's always healthcare coverage and SNAP. So my inferences, but I don't have direct data, I would say it's related to the economy.
Yeah.
Because the number one, and there's one program, it keeps inching up, and that's healthcare coverage. That is doing that.
If that trend continues through the rest of the year, that ties into staffing needs and caseload and workload and all that.
It can. So what I do understand, and if there's somebody that can correct me if I am wrong, that'd be great. But what I do understand is because of the public health emergency still being active, that is also influencing the number, because we are not actively closing any cases for individuals who no longer benefit or meet the requirements to be eligible for healthcare coverage. So there is an element of that. That's part of that as well. I don't have an exact number of how many people wouldn't qualify anymore today had that public health emergency be determined or ended. And I believe right now it goes through October, if I remember correctly. But
October,
31st, I think, yeah.
that's a good point, yeah. Any other questions, comments? I failed to mention that the case counts with economic assistance were in there, and then just an overview of case management, kind of the trends, which is fairly stable. To me, it looks like, and I continue, we will be working on getting some more data from our family services unit. We've talked to Matt a little bit about that, so we will be looking at that to provide in the future. The last item on any other questions? If there's any comments?
Not on that, but a separate
Okay.
question. And this has to do with, since you're going into next meeting, I'll just
Okay.
raise this question now, but this has to do with one of the things that we do as a board. And a question for you, Gail, you've been in over a little over 6 months now, correct? So in that time, have you identified any areas where we're underserving our population that you think that we should be paying more attention to? And I say compared to the rest of the zones, because as a state, this is where we're at, right? But as a zone, are we underserving our population in any manner that we think as a zone, should be looking to improve?
One area that kind of in talks with and starting to look at is some of those in-home care. And we have a contract that works with, they mainly service the Fargo area. So what I'm starting to look at is, how about out-region, rural Cass County, outside of Fargo? And I would suspect there's a need, but looking at that, and I had some conversations, because right now we have a partnership with Agassiz Valley, and they do some of that in-home work, to keep older people in their home and not having to go to a nursing home. And I would expect that in the future, that's still a need. And I questioned why we're not addressing that rural Cass County. So I'm working on that, just haven't got any further. And I'm open to others, but that's one of the ones that has popped up in my first little bit of time and started looking at that.
I got a question just to follow up on that too, but is there on the website, can you go out there and see how do you qualify for that in-home care, or what's the data behind that? How do you qualify? I mean, based on
that would be
economics, or, even.
Home and community-based services is a state program, so I'd have to go and look on that website, but I'm talking about county, zone services to that, because working in a partnership, maybe with some of the adult services people that our department comes in cross.
You know, it wouldn't hurt to maybe get us a little bit up to speed on some of that. We just talked about the healthcare, you know, if that's expiring in October, what is it now? And when it expires or it gets, you know, kicked out again for a while, what's being taken away in October that they currently have today versus the time limit or whatever? And because the requirement's gonna change. It'd be nice to just understand that, because it's hard to be an advocate if you don't know how they qualify, you
Or
know?
how many are going to be
Right,
kicked off that program at that
Yeah.
time.
Yeah,
You know,
it
just
will be
as
a significant, because my understanding, because of that public health emergency, they haven't had to review healthcare cases. So, somebody might not have been working and now working, but you're still qualified. It will be a big lift, and we might be able to put that on our next month's board.
You know, in the banking world, I see all these businesses that are crying for employees. Maybe they're not offering $100,000 a year salary, but it seems like if we're really short that many, either we got a training issue or, I don't know, it seems like it's hard to connect. But if our numbers are going up, you would think people would be pursuing some of that job stuff. Now, I know some of it, if you have a family of four, it's hard to get in, you don't have, you just can't afford it.
Unemployment rate is historically low.
Low.
And not just in North Dakota, but nationwide. Minnesota, I think, was boasting some lowest unemployment rate in the history of unemployment last week or something like that. But it's a bigger animal than anybody who's receiving services from county social services anywhere in the state. And I can speak, from experience with the TANF program and the jobs program. We have the lowest caseloads historically that we've ever had in the last 20-some years I've worked at job service. So the idea that there's people who are just kicking back and sitting on welfare and not working is not accurate. The workforce shortage is a bigger problem than that. And it's been coming this way for years. Well before the pandemic hit, we were having, nationwide, statewide, citywide meetings about the lack of employees. And then the pandemic hit, and then everybody reshuffled. They decided, I don't really like doing this kind of work anymore, I'm gonna go do something else. Doesn't mean that they decided to go do something else and stay home and sign up for welfare benefits. It was that they're doing something else that's not what they were doing before, leaving that employer in a lurch with an opening kind of thing. So it will be interesting to see, and I think there's a lot of families that are getting by, two headed households where during the pandemic one decided to stay home, and they realized they could make it by having one person at home, and life wasn't so bad, having to tighten their belt a little bit, and decided to stay that way. I mean, that's impacted the workforce to some extent too.
Yeah.
But it certainly isn't that, and there's a lot available to people to help them get into the work world now. Lots of training programs that are paid for that they can do to get better jobs that pay more. And you hear it all the time. An employer this past week was talking about how they lost a body person in their body shop that had been there for 15 years because Walmart's going to train them to be a CDL driver and pay them over $100,000 a year to drive truck.
Wow.
So there are a lot of jobs and there's a lot of money out there. I'm on a task force for this region where a number of companies, whether it's Mary Crystal Sugar, John Deere, Case, Sanford. Part of it is there's a lot of generational poverty in the state. You can look around and find that. And they're trying to do more of an outreach and make it more accessible on these websites because you can't find out where the jobs are. So there's a lot of push there. And for example, John Deere, Case, they'll pay for the training. You got to commit to them for a couple of years. Their tools, everything. They'll pay for your housing, everything. And they've been having fairly good success in a lot of the rural areas to help people make more money. Just help them get out of that. So, FYI.
Yeah, I think there's a few of those type of programs that probably recruit from the high schools, because not everybody is a four-year college, whatever. So it might be missing a segment also that might be out there, older than, and then maybe they don't want to go that 2-year
Or move.
Yeah. Yeah, so there's a lot of aspects. I think it's a challenge, of course, and we talked about this last time. We don't need to keep hitting it, but I think childcare is really huge. And the access to childcare and affordability, and we probably see that in family services a little bit too. I think our new exit survey might help with that too, because maybe that's impacting and can put a light on what we need to do internally to be helpful to help people stay employed too, if they're choosing to stay home, because now I'm, just have another childcare and you can't find that infant childcare. So, do you have a solution? Anything else? The last item on our agenda is the October board meeting. I wanted to bring this up a little bit in advance. The first Monday of that month is when North Dakota Association of Counties conference is. So I think typically the commission does not meet on that time either. I do have a conflict if we meet that Tuesday, because then the zone directors meeting is right after that conference. So my suggestion, I'll just throw this out there for the board to decide, either October 10th, which I know that would be a non-commission for you commissioners on this, or the 17th would be the next commission meeting afterwards, or if we didn't meet till the 17th, it's only a couple weeks till the November meeting. So I'll leave it up to you all. If we didn't do it on the 10th, I would suggest we maybe not hold a meeting in October, and then if there is an emergency or something, I could call a meeting via Teams, and then just have our next meeting in November.
Yeah, I'll just say, we schedule these meetings for Monday to accommodate the commissioners. We got way more than commissioners on this board. So I'm looking at the calendar. How about like the 5th? It doesn't have to be on a Monday.
Okay.
I'm just saying, I think you should.
What date is the 5th?
That's a Wednesday. I'm just throwing some other dates out there because that's not a Wednesday, that's a Friday. Oh, 3rd, I think. 3rd, how's it come with the 3rd?
I won't.
5th is a Wednesday. You're not here that week?
Well, I won't be back until,
Friday.
yeah,
So
Friday.
you're not here that week?
Yeah.
Okay, so it works out perfect. So, and the following week.
So the 10th,
10th works.
the 10th, Monday the 10th.
I would be comfortable waiting until November. Like you said, if there's something urgent that comes up, but I don't know that I've been to a meeting where something urgent has come up.
Yeah, 10th, I'm gone. You could be too. It's on our
So,
board.
why don't I get October on this?
Is there any reason why you would think the month of October would bring a
No,
necessary?
and I could share, and like I said, I could call a Teams meeting, or, with notice, call whoever can come. So what I'm hearing, if it's all right we will have our September meeting on Tuesday, September 6th, because Monday's the holiday. And then forego October, and then we'll meet again in November. Is that all right with you, Julie? Okay.
Yep, that works for me.
Has the meeting invitation been sent out for Tuesday the 6th? I'm guessing it has.
I don't think it has been modified, no.
Oh, okay.
I'll make note of that and get it sent, since it's an odd day.
Any other things to bring toward the board or comments? If not, I would entertain a motion to adjourn. Michelle, second. All in favor?
Aye.
All opposed? Thank you.